We're on your side with tonight's cover story, giving a voice to a silent crisis. Every single day, men, women, and children are abducted, abused, and exploited for money. Human trafficking is happening across the world and right here in some of our neighborhoods. And in most cases, it goes unnoticed. In fact, look at this. Only 1% of victims are identified. And according to the national organization Safe House Project, from the start of the pandemic, that number dropped to roughly 0.3%. So that is where HOPE training comes in. You see it here, HOPE. What does that stand for? It stands for Healthcare Observations for the Prevention and Eradication of Human Trafficking. It's online training developed by trafficking survivors to give people working within healthcare the tools to identify and help victims. Novant Health is the first healthcare network in the nation to roll out this training. And WBTV's Caroline Hicks went inside the emergency department at Novant Health's Presbyterian Medical Center in Charlotte to show us what this training looks like.
From the check-in desk to the exam room, countless people within the walls of this hospital have an opportunity to save a life.
If we see something, we need to be empowered to do something about it, and that's what the training is for.
Tamika O'Neill, the Chief Provider Experience Officer for Novant Health, is teaming up with Christy Wells, the CEO of Safe House Project, to bring training to the computer screens of every Novant Health employee.
The man sitting across from me is a regular buyer. The gal sitting by the door staring at the floor is a victim.
You've got familial trafficking, you've got grooming, you've got trafficker sources of control. We go through labor trafficking. So we go through a variety of different scenarios that help people understand how to identify it.
Creating a safe space for patients is important to O'Neill because for her, this is personal.
I'm a survivor, I should say a survivor of sexual abuse as a child. I was 14. And so I wanted to lean into this work just as part of my healing process, but also to stand in the gap for others.
How you speak versus what you say.
Trafficking survivors also had a hand in creating the program.
I was trafficked from 14 to 18 in Southern California, and again at 26.
Alia DeWeese was introduced to sex trafficking after meeting an older man on MySpace when she was just 13 years old.
It had been more than 6 months of him normalizing sex buying behavior, normalizing other people selling sex. When he finally told me that this is what I was going to need to do to continue this relationship, it seemed like two bad options. Either end this relationship, which I could not imagine doing at that time with that level of maturity, or consent to the trafficking experience.
It was the start of more than a decade of life in sex trafficking and exploitation.
I had the understanding that the reason I was having so much trauma from my experiences was because I was not doing it right, which was definitely a thought that a trafficker had used in order to keep me compliant.
She wound up in the hospital several times.
This was a time in our country in the early 2000s that people were not discussing what trafficking was and what it looked like. If people had the necessary information to be able to identify me, they would have been able to do it very easily and very early on.
What do you think it would have been like if at age 14 a healthcare worker had noticed you were showing signs of being trafficked? How do you think that could have changed your story?
I believe that I would have been able to break those trauma bonds and those misinterpretations of the world in order to get on a path that would have saved me a lot of heartache over the next 12 years. I ended up having children that I had while in exploitation. It would have saved them a lot of heartache.
At 26, Alia finally made it out alive.
The healthcare system was a big part of how I was able to get out. I was able to stay in the hospital when I exited my trafficking situation for a month in order to get into a trafficking-specific Safe House program.
Now she's using her trauma to help others escape it.
There's certain exams, certain language, certain procedures that could be very, very triggering for a trafficking survivor. So we go over what those are and how to mitigate those. And then finally, how do we connect a survivor with services? I can hand you a pamphlet, I can hand you a business card, or I can hold on to these, and you are welcome to come back and let me know when you want them.
How does it make you feel to know that maybe you're a part of this solution?
It is empowering. I really want to do more. You know, this is just step one for us.
So North Carolina is ranked number 6 in the nation for human trafficking. Here's my take, is that means we're number 6 in the nation for victim identification, because that simply is trafficking reports. And so as crazy as it sounds, I'm on a little bit of a mission to make North Carolina number 1, because if we can identify every single survivor that is being trafficked, I don't care if that number goes up and up and up, because that means that we're also able to help get them out, get them into restorative care, get them into healing, and that means we're effectively responding.
Safe House Project has a goal of training 1 million healthcare workers in the next year. They're also working with the World Health Organization and the United Nations on a recommendation of a systemized process for training across all healthcare networks. And Jamie, right now, this training is optional for Novant Health employees, but in the next year, the goal is to make it mandatory so they can get the whole team trained.
It's an amazing thing that they're doing right now. What specific signs are these healthcare workers looking for?
There are so many, because as you just heard, there are so many different forms of trafficking. But some of the things they say you can look out for is when a patient comes in, maybe they're not making eye contact with you during exams. Maybe someone who's with them is refusing to leave the room. That person's constantly looking to that person they're with for validation. It can go as far as the clothing they're wearing. There are so many different things to look out for, but what it really comes down to is they want these healthcare workers to listen to their intuition. If you have that feeling that, gosh, something is just not right, lean into that. You can get the behavioral health group involved, and then ultimately law enforcement.
It's not going to be a blinking red light. It's going to be a lot of subtle cues that could perhaps lead to really saving someone's life in all this. People at home might be watching thinking, is this some sort of training that I can take in this? Because I'd like to also kind of be on the lookout.
Absolutely. This is open to the public, and we've actually put that link on our website, WBTV.com. Just click on this story, and you can find the link, and you can go through the training. It's all online.
A really impactful story, important story. Caroline, thanks for sharing it with us.
Thank you.
Appreciate it.